Good morning, everyone. Today we're going to discuss about accreditation. Before going to the topic, let me introduce myself. Myself, Viruthasarani.K, Professor, Department of Community Health Nursing in SNS College of Nursing. Let me move to the topic. Accreditation. Accreditation is the process whereby an organization or agency recognizes the college of university or program of study as having met certain predetermined qualification of standard as given by Selden 1962. Accreditation, a process of review and approval by which an institution, program, or specific service is granted a time-limited recognition of having met certain established standards beyond those that are minimally acceptable. This definition given by ICN, that is International Council for Nurses. Let me discuss about the functions of accreditation. It aims to protect the autonomy of various health services programs. It preserves the quality of nursing education. It protects the public from ill-prepared nurses. It protects the institution on sound and unsafe political pressure. It helps the practitioner for the broad scope of nursing practice, and it safeguards the institution from social education and political pressure. It helps in the registration of nurses. It prescribes the syllabus. It grants recognition to school and colleges. It guides the school and colleges of nursing according to recommendation and criteria. It also services to prepare competent to serve the public. So these are the functions under the accreditation. So accreditation or services are provided this kind of function for an institution or a college of nursing or a school of nursing. Next, types of accreditation. What are the types are there? The first type is probationary accreditation. It means it enables the nursing institution or organization applying for accreditation first time. So probationary means first time they're applying for accreditation for a period not more than 3 years. So first we are applying the accreditation process. They are giving only 3 years, not more than that. Okay. And next is provisional accreditation. It means it enables nursing institution or organization which has been accredited but which complies with most but not at all of the required standard to operate for a period not more than 1 year will address the area of concern. The probationary means we need to apply only for 3 years and not more than that. But in this case, the certain institution or an organization not following the standard, they visit or they go for or suddenly or unexpectedly the agency will do the inspection and they are providing the further steps and their authoritative person, they are having some authority to withhold the accreditation also. That is provisional accreditation. And next thing is full accreditation. It indicates that the institution complies with all the required standard and may operate for a period of 5 years before applying for re-accreditation. So each and every 5 years, the particular institution should review or renew the accreditation process. That is full accreditation. And next is accreditation process. What are the processes are there to get a accreditation in an organization? There are 5 processes are there. The first one is institutional self-study. That is, it is the self-analysis of performance completed by the college based on a standard of accrediting association. So each and every agency or association, they have some criteria and standard. The institution should follow the particular standard if they are completed, that is, with their self-analysis of performance, that is, institutional self-study process. And second one is peer review, that is, their co-workers or colleagues, they are doing the analysis, that is peer review. That means peer review occur because of the board involvement of various stakeholders in the educational environment such as faculty, administrator, key partner and public. So these are the members that act as a peer review member in case of accreditation process. And next process is site visit are typically conducted. Site visit is very difficult to conduct. So what they're saying are typically conducted to verify the result of self-study and to provide additional clarification to the accrediting agency. This action occurs after submission of self-study report. The particular institution should submit the self-study report to the agency. After submitting the report by the institution, the agency should do the site visit. So it is very difficult to do the site visit process because they need to clarify everything is submitted by the institution or organization. And the next one is revision. It depends or it varies from one agency to another agency. In particular, accrediting agency, they are doing annual periodic revision, and particular agency are doing once in a 3 years, or 3 years once they are doing, or 5 years once are doing. It depends or it varies from one agency to another agency. This process is occur after the submission of self-study report by the institution. And the last process is monitoring and oversight, that is occurring through the idea of annual report by the college. After submission of annual report by the college, this process, that is the agency is evaluated overall record submitted by the institution. So these are the 5 processes of accreditation. Next, and this is the accreditation. So some of the types are there. National Accrediting Agency, National Professional Accrediting Agency, State Accrediting Bodies. Here are some of the examples related to National Professional Accrediting Agency. One is Medical Council of India, Indian Nursing Council, that is INC, Dental Council of India, Pharmacy Council of India, Central Council of Indian System of Medicine. Indian Nursing Council, that is INC, is official accrediting agency especially for a nursing program, which include diploma, that is general nursing and midwifery, BSc nursing. It include both basic and post basic, MSc nursing or MPhil, and PhD, that is doctoral program in nursing. Problem and challenges of accreditation. What are the problems and challenges faced by the various accrediting agency? The first and foremost thing is quality consciousness at all level will take time. At all level, we want to maintain the quality means it takes a lot of time. That is one of the basic challenges faced by the agency. And second thing is sustenance and consistency of effort will be required. So whoever is making or doing the effort, that organization should need a consistency and sustenance. That is also one of the challenges faced by the accrediting agency. And next thing is commitment on a consistent basis. Each and every employee should have a commitment on their work. That is also another challenges. And next challenge is high rate of attrition will require repeated and continual training. We want to maintain that is a particular organization need to maintain a standard and quality means they need to have a continual training program, especially in case of accreditation. How they need to conduct the training program through by conference or workshop or seminar and panel discussion, etc., etc. And next challenge is public sector will take a longer time to get into the process. In a private sector, we can easily accept and adapt and accommodate the accreditation. But in case of public sector, it will take year and year. So it is a longer time to get into the process. And these are the challenges are faced by various agency. By concluding this topic, that is various healthcare professional itself raising question about the cost of accreditation program. What about the cost of accreditation? So how we can afford to utilize or use the accreditation? They are raising questions. So for the question, other authoritative healthcare professionals should create awareness, especially by the physician, should create awareness about cost benefit of accreditation by conducting a small group discussion or a seminar or a workshop or by a panel discussion or through by a webinar. They should create awareness. By creating awareness, all the private as well as the government sector should accommodate into the process of accreditation. So with this, I'm concluding the topic. Thank you. Have a nice day.